PCOS is becoming increasingly common, unfortunately. I've seen that grow in my time as a practitioner. I think if we identified it these days, we wouldn't probably call it polycystic ovarian syndrome, because it's not all about the ovaries. It's actually a whole body syndrome that is about metabolism and insulin resistance. And what happens is, due to insulin resistance, people have high androgen levels, hormones like testosterone. That's why people with PCOS sometimes get acne or hair where they don't want hair, that kind of thing. We see some insulin resistance, which is why PCOS patients put on what I always call unfair weight, weight that they can't shake no matter how hard they work at it. Irregular periods is often a sign, irregular and long usually, like long cycles, like 40, 50-day cycles. That's quite common in PCOS patients. And lower fertility. I don't want to say infertility, because in my experience, people with PCOS do get pregnant, actually. We just have to all work a little harder for them and solve some problems. Well, acupuncture, according to studies, can induce ovulation. There was a famous study from China that looked at rabbits, and apparently rabbits don't ovulate if they're not having sex. And what they did was they did points over the rabbits' ovaries, and sure enough, the rabbits, even though they were anovulatory and not sexually active, ovulated. And building upon that, several researchers looked at doing that for human beings. And we still use those same protocols today at the Unova Center to help women with PCOS ovulate, and they're very successful. It sometimes takes us 2 or 3 months to build up some rhythm and get things moving. But we can usually speed up ovulation in these long cycles that women with PCOS often have. Insulin resistance is a real issue with PCOS. And when I'm explaining insulin resistance to my patients, here's how I describe it. You have to think of insulin like it's a bit of a key that opens a lock in the cell and lets glucose, which is just energy, into the cell. And if that lock has been overused, if you've been quite bingy when it comes to sugar over a period of time, it starts to not work. It gets a little creaky and it doesn't let all the glucose in. And your body reacts to that by creating more insulin, but there's a little bit of a stagnation there because it's not working on the little lock. It's not an effective key anymore. So you get high blood sugar, and that leads to the high androgens. So the first thing I always do with PCOS patients is help them modify their diet so that we deal with the insulin resistance. Here's what I usually tell my PCOS patients. Control your insulin resistance if you have it. Yeah, if you have elevated glucose or blood sugar, let's work on your insulin resistance by cutting out sugar to start with, and then introducing it in much smaller doses and gently, and in longer acting foods like whole grains and things like that. And I always tell people this is a 3-month project to get your insulin metabolism back to normal. You're not going to have to live like this the whole time. It's really a project for 3 months to reverse your insulin resistance. Manage your stress. You're more susceptible to stress than other people. Research shows that women with PCOS have higher levels of cortisol, which is your stress hormone that's meant to help you fight or flight your way out of trouble. So find a method of switching off. And it doesn't have to be all sort of fancy or new agey. You can just watch a silly movie or read a trashy magazine or something. Just find something that stops you just being alone with your head, worrying and thinking. And then eat a broad range of foods, apart from sugary foods and high carb foods. I usually advise a sort of Mediterranean diet for people with PCOS. Lots and lots of healthy fats, some good quality lean protein, including fish if you eat it. Lots of vegetables. Stay away from the more starchy ones like carrots and parsnips and peas and things, but other colorful vegetables. Chinese herbs can be very helpful. And remember that acupuncture has been shown in studies to help women ovulate if they're ovulating late due to PCOS. We sometimes, as well as doing acupuncture, refer our PCOS patients for fertility massage. And what we're trying to do is increase blood flow and movement in the abdomen. That deep massage also helps to move your internal organs until they're in the perfect alignment. Often people's uteruses are a little bit tipped, and in PCOS, because the ovaries are swollen, that can often happen. And then you can imagine all the little blood vessels that are going to the uterus are like hoses with little kinks in, and so you're not getting as much blood flow. So if we feel like that's going on, we refer them to one of our reproductive massage therapists. They do some deep abdominal massage, which helps sort of hurry things up and helps people to ovulate. Herbs for PCOS are quite specialized, and I make a separate formula for each PCOS patient because honestly, no two are the same. I have people who have PCOS and have the classic weight gain, skin problems, hair growth, but I also have people who are super skinny and exercise a ton who still have PCOS, and they would require completely different herbs. But here's how I think about a herbal formula for PCOS patients. I would put some chi tonics in to help with metabolism. Renchen, ginseng, baiju, atractylodus, fuling, poria, and jagansa, which is honey fried licorice. And then I add something to help with fluid metabolism, because water retention is also an issue with PCOS. Ligusticum, chuan zhuang is one of my favorites, and I probably add chen pi, which is just orange peel and makes the herbs taste nice, and bancha, which is a little fruit, Pinellia. And then I usually add something for stress, because a lot of PCOS patients have elevated cortisol. And my favorite herb to add is swan's aren, which is ziziphus. And so that would be the basis of creating a formula for a patient with PCOS.